The National Health Service has recorded its worst ever A&E performance, according to new figures out today. Pressure is continuing to grow on the service. Official data shows the number of patients seen within A&E's 4-hour target was down to 79.8% last December. That's despite the government target of 95%. And that's down on the 81.4% that was recorded the month before in November 2019. And the pressure continues to mount on the service with nearly 600,000 emergency admissions in the month of December alone. That's a 2.9% increase compared to December 2018. Well, joining us now from central London, the Deputy Chief Executive of NHS Providers, Saffron Caudry. Saffron, good afternoon to you.
Good afternoon.
These figures are pretty awful.
Yes, we are seeing some worrying figures in terms of performance out there today. I think what it shows us is that there is a real pressure on emergency care at the moment, and particularly a pressure in terms of those who are having to wait a long time between the decision to admit them to hospital and actually getting them a bed. So that's up 8 times on the figures from last year. So that's a really worrying spike in demand there.
Yeah, many patients waiting over 12 hours. What can be done about this? I mean, the NHS, we heard so much about what pressure it was under during the general election campaign. And this new government is now up and running. What do you need to improve this service?
I think what we've got to be clear about is that although there's been really welcome investment in the NHS, and we want to reinforce that point, new money for the NHS is really important. However, what we've got to remember is that demand is just going up and up. So talking to hospital leaders over the last couple of days, what they've been telling us is that this isn't just about frail elderly people in hospital. This is about all parts of the population, actually more turning up at A&E, more accessing the health service through the A&E departments, which really puts a pressure on hospitals. And there's also pressure on all of the other parts of the system as well. So we've got the most ever conveyances to hospital and use of ambulance services than we've seen. And we know the pressure's really on in social care, and that causes real problems in hospitals and in wider NHS services when social care can't meet the demand. Hospitals, NHS trusts across the country are really working hard to work with their social care and local authority partners, but they are really stretched as well. So this is causing a real issue. So in terms of solutions and what we can do, we've got to make sure that we invest properly in social care. So we're looking for the government to bring forward real proposals to ease the issues for social care, and also to focus really heavily on prevention as well as supporting transformation in the NHS.
Are you confident that these figures can be improved on this time next year, or do you think it's going to get worse before it gets better?
Really hope that it gets better this time next year. I really hope that I won't be sitting here saying that we've had the worst year ever. But what we've got to do is make sure that we take those steps. So we've got to make sure that we look at social care and improve social care. We've got to make sure that we focus on how we actually stem that tide of people coming into accident and emergency departments. And we've got to think about primary care in there as well, because often people are turning up at A&E departments because they're struggling to get a GP appointment. That's not GP's fault. That's about investment in GP services, and it's also about making sure we've got an adequate workforce. So there's a lot going on here that we really need to navigate our way through, and that's a big task for a new government.
Saffron Caudry, Deputy Chief Executive at the NHS Providers, thank you very much. We're joining me now, Dr Kishan Rees. He is a part-time A&E doctor who's worked the last 3 Christmases. You're on the front line of these figures.
Well, I mean, thankfully, I'm only on the front line for some of the time, and I have the utmost respect for my peers, my colleagues who are doing it full time, because it's just absolutely atrocious, the conditions on the front line for doctors, nurses, any healthcare professional working in the health service at the moment. And we heard that it's a new government. It's arguable. I mean, they've been 10 years. Boris Johnson has said that people have lent votes to him as the Prime Minister, so let's hope that they spend time repaying faith and actually doing real differences on the front line so people can see the benefit. It's not unusual to see an 11, 12-hour wait when you come on in the morning for a shift.
Yeah, talk to me about what it's like. So if you arrive for a shift over this winter period, What's it like at A&E? Because we hear about all the figures, over 79% of patients waiting, over 8 hours to be treated. But what's that actually like?
It's really difficult, and it's been getting worse year on year. So I qualified in 2009, and every year it's got a little bit worse. It's not unusual, as I said, for people to be waiting on corridors, corridor nurses looking after them, and ultimately it's a case of how can we offer the best care for patients in that kind of environment. So we really need to have an improvement in conditions. We just have to, because it's got to the point where it's on its knees. It's at breaking point. People have been saying that. Let's hope the government listened to those warnings, and we could do with effective opposition to make sure that they're held to account.
Kishan, do you think that the A&E, it really is the front line of the NHS in terms of, it's right at the spearhead, it feels the effects first. Is it an indicator of just how bad it is in other areas?
Absolutely.
We were hearing there from Saffron about mental health services, social care.
So mental health services have been neglected for many years. Working in A&E, it's not unusual for me to see a patient who's got mental health problems and is told you have to go to Scotland as that's the only mental health bed in the country. It is definitely a marker of what the other services are like, and patients are turning up at A&E. We mustn't blame those patients because they're seeking help and that's how they can get in. And what I feel as a frontline doctor seeing these patients is the messaging is going to the wrong people. So an 80, 90-year-old lady who lies on the floor having broken her hip for 6 hours, not being able to call an ambulance and not wanting to come into hospital, we really need to make sure that we are prepared for a population that is getting older. So there will be different demands on the health service. But in order to achieve that, we can't have a political football going back and forth.
Kishan, what's it like for you trying to do your job? Because, as you said, you are bearing the brunt of this. You have to deal with these patients that are waiting over 8 hours.
I mean, I only do it part-time. I think that's a really important thing to say.
You're still there having to deal with these patients who are having to wait long times and are really suffering. What's that like for you?
So on a human level, if you connect to people and you apologise and say, I'm really sorry that you've had to wait, they tend to warm to you and they're OK. I think we need to be making it appealing and attractive so people in the NHS can have part-time careers, can have flexible careers, can do other things to broaden their horizons and not work the brutal rotas that are absolutely wrecking people and causing burnout.
Is that why you're part-time?
I left for several reasons.
Okay.
Speaking out is a problem.
Yeah. Okay.
And I found out about that in quite an interesting way. But also, I found that because I didn't get to become a consultant in emergency medicine, there's other areas that I'm interested in, like management, like education. In the NHS, it's a very outdated model that unless you're a consultant, you're not going to be involved in education. You're not going to be involved in managerial to a high level. So, yeah, there's lots of different reasons, but I think we need to be looking after our workforce because over Christmas, the camaraderie among the staff working in A&Es across the country was amazing.
I would imagine, yeah.
Yeah.
OK, well, Kishan, it's really good to talk to you, Dr Kishan Rees, part-time doctor in the A&E, but that is not to be sniffed at. That's incredible work you're doing. Thank you so much for coming in to talk to us about those NHS figures. You're watching the Sarah Jane Mee Show here on Sky News. Coming up, we'll take a look at the sport.